sensitive pelvic area and how that can be a biomechanical issue is the subject of this video. I'm going to explain to you some of the nerves that sensitivity of the pelvic area can come from and how biomechanical issues can contribute to it. And you can see so many different providers without really getting to the root cause of this. So I hope you find this helpful. I would love to hear more about what your thoughts are. So let's continue. There is a nerve that comes from the lower part of your lower back and your sacral area, this region, called pudendal nerve, and it will go inside your pelvis. It goes, this is the yellow part that you see. It goes inside your pelvis, it goes over and under, and there's like a whole path that it goes through. It ends up being going to the perineal area, to the vagina or vulva, I should say, and the penis, and also the anal area. So the sensitivity, the sensation is in those areas are from pudendal nerve. Pudendal nerve is also used for the action of the sphincter. A lot of times people look at the sensitivity and they Google it, and then they find pudendal neuralgia as one of the potentials, and then they freak out. I see a lot of them in my practice. But the question to ask when someone comes to my practice, of course, this is after they've tried so many different things. They've UTI, STDs, all of those are being ruled out. They've been put on antibiotics. Just a whole bunch of stuff has happened. They might have seen pelvic floor physical therapists, and well, other than the fact that most likely they didn't like any digital assessment through the anus or vagina for that matter, and not really seeing that much result, then they end up in my practice. And then we can very easily assess and work towards correction of it. What is actually the question I ask is, give me more information. So what I just shared with you is part of the information. What we need to look for is, what is your lifestyle? What kind of sports do you play? What kind of workout habits do you have? Do you have any history of lower back issues or sacroiliac joint issues? We're not talking about pain here, we're talking about performance. What is your posture like? What's your movement like? How do you walk? How do you squat? How do you work out? If you're clenching your butt instead of flowing forward in your walking, you definitely have all the reasons for having issues there. Do you have tightness? Do you feel tension in the perineal area? These are all things that point in the direction of what is referred to as mechanical compression of the pudendal nerve. Of course you can have it. But if the approach, the standard approach, is going through the anus with the hopes to get there, going through vagina with the hopes to get there, or putting a nerve block to block the nerve, well, I'm not removing the mechanical compression of this nerve as it traverses through the different muscles and different body parts within the pelvis. The question I always ask is, what is out of whack and not with the proper tonicity and strength inside this pelvis that is causing nerve irritation? And it is always biomechanical faults, meaning this individual is not using proper ways to move around. You don't even have to be an active individual, active meaning an athlete. You don't have to be. You could be sitting in such a way that you're collapsing over the structures and you're irritating the nerve. It's so easy to do that, and it doesn't have to be a life sentence. It doesn't have to be this drastic thing that people are poking and injecting and removing parts, and they're doing this and that, and an ongoing agonizing pain. So what is the approach? The approach is getting back to the basics. Listen, if you went from helpless infant to running toddlers without anyone coaching you, guiding you, you went from being a limp baby to being fully capable of walking, going through all those stages of development, that seems to me like the manual of movement. In fact, you and I and everyone else you know in your life that are walking have gone through the same methodology. If the whole world was a petri dish and this was an experiment, it produced the same result. Why are we not keeping that in mind? Why are we not communicating that to our patients? Why aren't patients wanting to understand how to be? That's kind of like trying to always get a ride to go somewhere instead of learning how to drive yourself to places. You know everything about the principles of driving. You've exhibited how to drive. So it doesn't matter if you're driving here, if you're driving a different state or in a different country. You got it. Do you know that about your movements? Just because you got two legs and you can go from point A to B does not make it right. So all of these issues that we're facing in today's society, in this country, are honestly as a result of our sedentary lifestyle. And if you're thinking, I don't have a sedentary lifestyle, I'm gonna say, do you work behind the computer? Are you sitting more than an hour every day, an hour at a time? If the answer is yes, you have a sedentary lifestyle. If you're sitting behind a computer and at the end of the day you go to the gym, you have a sedentary lifestyle. Why? Because you sat for 8 hours, you took your exhausted body, you went to the gym, and now you're asking this exhausted body to perform 2 sets of 12 with this much weight. Do you see how unreasonable that is? We've got to pay attention to answering the right questions and really sitting down and figuring out what to do and how to be. Pudendal neuralgia is not the end of the world. And the way it is being tackled and approached and assessed and diagnosed, in my opinion, is not right. This video is all about my experience, what I see in my practice. And by the way, what I see in my practice is what is chronic, what has not worked throughout the years, not necessarily all in a row. And when people come here, they are coming here because they've heard of what it is that I do, and that is my approach. When you're seeing your provider, are you asking the right questions? Are you asking why you have this, what the approach is, and then ask how that approach is going to solve the problem? I strongly suggest you do. If you have any questions, please contact my office, and I'll be more than happy to take the call and see what's going on. Hope this helps, and thanks for subscribing.